Welcome back. Fox 8 News in the morning. COVID-19 is hitting some groups harder than others. In fact, minorities, especially African Americans, are seeing a higher rate of sickness because some communities are simply not taking the threat seriously. Want to check in with Dr. Margaret Larkins Pettigrew. She is the head of Community Impact and Diversity at University Hospitals, and she joins us right now. Doctor, first of all, thank you for joining us this morning.
Thank you for having me, Wayne.
Let's get right to it. You say some communities you've said they're rejecting the facts about COVID-19. What do you mean by that?
So, because University Hospitals has always had intention to reach into the communities and make sure there was access and make sure that there was this partnership with our communities. And we serve a large population of Black and Brown communities. And so what we're finding with our patients during this COVID-19 pandemic is that they're really not taking it seriously. There's three things that we're really concerned about. One is that they don't understand the pathophysiology of the disease, so they don't think it is serious. And I hear things like, this is a lot of intentional hype, which really concerns me. The second thing is that they don't have a great grasp on what to do as far as taking care of themselves, wearing masks, making sure that they're spacing themselves. And I ask questions about it in the community, why? And they say, well, this is just a lot of hype. The third thing they're really concerned about is this issue of trust.
Okay.
And hearing that these patients talk about the fact that they don't want to wear masks. And when I ask questions about them wanting to wear masks, they give me a lot of things to think about.
What do they say when you talk about wearing masks? What are some of the answers?
Well, some of them don't have actually masks, and they feel that wearing a mask that is not from a clinical perspective really sets them up to be a target.
Yeah.
And they're worried about, we've had this whole long history of profiling, the long history of just Blacks being mistreated. And it goes way beyond the Henrietta Lacks, way beyond the Tuskegee experiment. And so now we're asking our patients, we're asking our community to wear masks or something to cover their faces. And they're being confronted in places that they have never been confronted before. Especially Black men.
Yeah.
And Black men are targets.
Well, let's talk about how we can change the narrative, how we could, get the community, more aware about what's happening out there and how it's affecting us.
Right. Well, first, we know that we have greater than 50% of the population through the country that are dying from COVID-19. And that's one thing that we really have to pay attention to. Why that's happening, for multiple reasons. Comorbidities, continued structural racism, multiple things that contribute to this. But the issue is that we have to really be partners with our healthcare systems, partners with university hospitals and the rest of our great institutions to really understand what the pathophysiology is, to understand how it really is affecting us as Black and Brown people, and to really maintain some protection. The second thing is understand what's clear about how you wear your mask, when you wear your mask, social distancing, all the things that you need to do to protect yourself and your family. And then the third thing that we're doing at university hospitals is saying that we're going to take care of you. Don't stay home when you're really ill till the last minute, because you're going to succumb from this disease. Wear your mask. And people are now they're denying and refusing testing when they come to the hospital. That is, why are we doing that? Accept the testing. Let's understand how extensive this disease is in our community. And we're doing this at university hospitals. Another big thing we're doing is we put the first testing center down at Otis Moss. So we were coming into the community, partnering with YWCA, Cleveland Partners, really to make a difference and to get the message out.
All right. You guys are doing a good work. Hopefully people will start to take notice, no doubt about that, because as you said, we're being hit harder than any other community. Dr. Margaret Larkins Pettigrew, thank you very much. She is at University Hospitals. Thank you for your work. Keep up the good work, and I'll see you down the line. Thank you very much.
Thank you very much, Wayne.
All right.
Have a good day.
You as well. Up next.